Hi, today I want to continue discussing about the alginate impression material, and I want to give you some tests for practicing and checking your knowledge. Okay, let's start to discussing the test about the alginate gelation time. So doctor requested to you mix alginate and take an impression. While measuring the water, you got involved in conversation with patient and did not notice how hot it was. This oversight will shorten the gelation time, make the mix unusable, lengthen the gelation time, and not affect the gelation time. And the answer, of course, is the shortened gelation time, because we know that higher temperature, the shorter gelation time of alginate, and lower temperature, longer gelation time. The next test is about alginate too, and today was a very busy day for Ashley, the dental hygienist in our office. Ashley took alginate impression on her patient in the morning who needed a night guard. Since she was busy, Ashley left the alginate impression in the lab most of the morning. Ashley decided to place the impression in the boil of the water so that they would not dry up before she had the chance to pour them up in the dental stone. Which of following was the result of Ashley leaving this impression immersed in the water for a few hours? Gelation, hysteresis, synersis, imbibition. The answer is the imbibition, because the first thing that we have to remember when we read the tests like this, that alginate material has a nasty habit to rigidly give up water or gaining the water. When we dry the impression will give up the water. This called synersis. And when we stay the alginate material in the water, it will be gaining the water, and it's called imbibition. So in this case, the answer is imbibition. So the next test. Some impression material are most accurate when at least 3 mm of space is present between the impression tray and oral tissue. Which impression material below shows this characteristic? Polyethers, polysulfates, silicons, irreversible hydrocolloids. The answer is irreversible hydrocolloid. The first question I think that become to our mind, what is this material? Yes, we have to remember that irreversible hydrocolloid is the alginate material. And we have to remember that alginate impression is most accurate when at least 3 mm of space exists between the impression tray and tissue, and the other impression times are more accurate when the small but definite space exists between the impression tray and tissue. So the next test, if your patient indicates the tendency to gag while taking alginate impression, which of following maneuvers can help make the procedure easier for the patients? Select all that apply. Lessening the time to take an impression, using cold water to mix the alginate, having the patient breathe through his or her nose, sitting the patient in the upright position, setting the anterior portion of the tray first, mixing the alginate repeatedly. And the right answer is lessening the time to take an impression, having the patient breathe through his or her nose, setting the patient in the upright position, and mixing the alginate repeatedly. So I'm waiting for your comments of why these four answers is true, your opinion and your experience. It would be very interesting for all of us.